bring you the latest news right here in South Africa and across the continent. This is the Newsfeed Late Night. Thanks for staying on. Your reporting continues now. KwaZulu-Natal continues to rank #1 in the country in terms of the number of active cases, with over 60,000 active cases confirmed, and second to Gauteng in terms of the cumulative cases. According to the Premier Sihle Zikalala, the province is witnessing a death on a catastrophic scale that has never been seen in living memory. Premier Zikalala joins us now to discuss the province's efforts in fighting the pandemic. Premier, good evening and thank you very much for your time.
Thanks a lot and thanks for having us in your program.
Now, Premier, looking at how the virus is behaving in KwaZulu-Natal and the districts that have been hit by the virus, we're talking eThekwini, Mgungundlovu, King Cetshwayo, Ilembe, and Ugu. Have you considered a district risk approach in as far as what is happening in the various districts?
Yes, we do have the district plans that are in place. And in each district, we've got a risk assessment approach as well as the mitigating strategies that are being implemented. We must, however, say that the fact that you get other districts being the epicenters, it doesn't mean that there are districts that are out of the woods. And therefore, it will be necessary to ensure that even those districts that are not yet highly affected are taken on board. And that's why we have this provincial-wide strategy, which is helping us now to ensure that we intensify screening and contact tracing.
With 72% of your beds now occupied, they are not full, but the number of infections are increasing at an alarming rate. Is there a plan in place for additional beds?
Yes, there is a plan. We are going back to reactivation of the field hospitals. As we talk right now, in these beds that are now in place, we have added the Royal Showground in Pietermaritzburg. We're working to add another in Lower South Coast, which is Ugu. We're working with the private sector to ensure that the private sector provide us with their establishments, such as your B&Bs and your hotels, to ensure that we increase the bed capacity. And we believe that we would not run short of beds.
Right. You are mentioning intensification of enforcement, particularly around businesses that are not complying with a simple thing as closing at 8 p.m. What is that enforcement strategy looking like?
Enforcement strategy talk to direct inspection, which is conducted by our law enforcement officers, working together with the Department of Economic Development, Tourism and Environmental Affairs. We are inspecting all companies that are operating, but also all other outlets that are operating to ensure that they adhere to the regulations that are in place. And those that are found to be not in compliance, serious actions are being taken. Let me just make one typical example. Those that are involved in alcohol industry, we have taken decisions in some cases to withdraw even licenses where they are not following the regulations.
Now, there is, of course, growing calls within your province of the use of ivermectin to be endorsed for COVID-19 infections. As Premier, what is your view on those calls, but also respond to the question of homemade remedies, which more and more people in your province seem to prefer?
Yes, let me start with the first call. Look, in terms of medication, any medication that is used in South Africa, it should have gone through particular processes of testing and then get accredited by the National Department of Health and authorities within the department. And therefore, it is not for us, and if there are such calls, let those calls be directed to the relevant place for that office to assess and not to just grant any medication, but to ensure thorough assessment, because we will not want to endanger the people. We know that others are using homemade. The homemade will include steaming, include umhlonyane and others. We would want to say to the people who use those, we cannot stop them from that, but let them ensure that they, if they are infected, also go to the hospitals so that they get assistance while it is ailing.
Yeah. So, Premier, are you saying as a province you've not made that request to the health minister on the possible consideration of the endorsement of ivermectin as a COVID-19 therapeutic remedy?
No, we have not made that call. And that call won't come from us because we cannot prescribe for the department while we have not done scientific analysis. And therefore, the matter must be referred to the national department.
All right. In terms of the issue of homemade medicine, there is a sense, though, that you still would want to get those who use homemade medicine to still go and be checked by medical professionals, because you're saying more of them are deciding to stay at home until quite late in the process.
Yes, people will stay at home and they will not want to present themselves to healthcare facilities on the basis that they are using traditional methods. And we would want to encourage them to ensure that they get assessed, because it is important that people present themselves while they can still be assessed and assisted. If you go to the hospital when the levels are too low, it becomes difficult to save you. And therefore, we appeal to the people to engage, to go to healthcare facilities as early as possible.
Yeah. You don't think, though, part of the challenge of people not wanting to go to hospitals is that there is a level of uncertainty, particularly around the messaging? I mean, there is a wide range of disinformation that is going on, for example, around the allegations of a relationship between COVID-19 and the 5G network, but also there is a lack of information and clarity around what the vaccine is going to be and how that is going to impact on the lives of the people.
Yes, that might happen because we have seen that the disinformation have caused a serious damage, and that's why our message is clear. Let us unite and send one message to the people. We cannot have leaders or members of the society spreading wrong information and peddling lies and things that are not founded. And we want to be firm. Let us ensure that we unite. Our message in this regard is that this is a war. The pandemic is like a war. On one side, you've got humanity, all people who are ensuring and fighting to ensure that we sustain life and livelihood. On the other side is this pandemic, which is killing our people in a very serious way that have never been seen before. Let us unite, and we want to send a clear message that we will be taking actions against those who will continue to peddle misinformation.
Yeah. Now, I understand taking action against those who peddle disinformation. How about your own communication strategy? Because it seems there is a gap that has been created, and therefore when these rumors become proliferated online, they become believable because there is this gap of information and people are not quite sure, for example, how the vaccine is going to work, how the rollout is going to work, and what sort of therapy they should be seeking.
Our communication strategy has been effective and we've been able to engage with people. It's just that there are few individuals who have used the social media to spread disinformation. And that's why last week, Friday, we had a very successful webinar with various professionals analyzing and explaining the origin of COVID-19, but also analyzing the origins and the evolution of the technological development, especially the 5G, and whether it has a relationship with COVID-19. And among the analysis that we got there was the analysis on what people are saying. People are clear, the majority are with us, but there are those few people who are confused by these few individuals who are spreading this information in the society.
Right. So while you deal, of course, with the current new cases of infections, you're also looking ahead as far as your rollout plan for the vaccines. You're saying you're planning to roll these out faster. How are you going to do that?
Right now, we are starting identifying vaccination sites in each district. Of course, there are districts that are more populated, and therefore the vaccination centers will be higher in those areas. And it then goes down to say we go to districts that are less populated. But the starting point is to ensure that the healthcare workers and the frontline workers as a whole are vaccinated at the beginning, as the minister, Dr. Zweli Mkhize, have announced. So the plan will be announced in the next week or two to announce now the vaccination centers, but also to educate and create awareness about the vaccine itself, and then to work as through the Department of Health to ensure that those who will be managing that vaccination are properly trained.
Now, Premier, let's talk about the delay in the reopening of schools. Are you seeing any defiance as far as that is concerned in your province?
We would want to applaud the Department of Education as well as all stakeholders within the education sector. In KwaZulu-Natal, we have not seen any defiance, but we are continuing to monitor. So far, we've seen that all schools, including private schools, have accepted the direction that have been given by the government. This is done in the interest of the educators themselves and in the interest of our learners. And therefore, we say, let us be together. Let us ensure that when schools open, we put in place the plans to ensure that we work to cover the syllabus as expected.
Premier of KwaZulu-Natal, appreciate your time and thank you very much for joining us tonight. That is the Premier of KwaZulu-Natal, Sihle Zikalala.